All right, let's dive right in, shall we? Today we're going deep on actinomycosis, that bacterial infection that can really throw a wrench in the works,
Yeah, can be a tricky one.
especially when it comes to diagnosis, right?
Right.
We've got some great resources lined up for this deep dive. Microbiology, of course, always a good starting point.
Definitely.
Plus, we've got the latest from the CDC, and to really bring it to life, even tapped into the visual database over at Microbe Canvas.
Always helps to see what you're dealing with.
Absolutely. So for all you medical microbiologists out there listening, get ready to, get ready for a bit of a deep dive.
Into the world of actinomycosis.
Yeah, exactly. It's a disease that can be, kind of a pain to diagnose.
It really is. It's often mistaken for something else entirely.
And I guess that makes sense given its tendency to mimic other conditions.
That's right. And the fact that it's, a chronic, slowly progressive infection doesn't exactly help matters.
So before we jump into the whole diagnostic maze, maybe let's take a step back. What exactly are we talking about when we say actinomycosis?
Right. So actinomycosis, it's a bacterial infection.
Oh, I knew that much.
Right, of course. But what really sets it apart is this: the formation of abscesses and the destruction of tissue.
That's not exactly a walk in the park, is it?
Not at all.
And Microbiology points out, I think, that there are a few bacterial bad guys behind all of this.
Yeah. You've got the usual suspects, the ones we see most often.
Like who?
Yeah.
Hit me with the names.
Okay, so Actinomyces israeli is a big one, and then there's A. seriae. They're often found in the oral cavity.
The mouth, you mean?
Exactly. Hiding out in the mouth.
Makes sense.
Yes.
But then you've also got Propionibacterium propionicus hanging around, right?
Right. It can be part of the picture, too, adding to the fun.
Oh, joy. But it's not always a one-man show, is it? I mean, actinomycosis kind of likes to bring its friends along for the ride.
Oh, yeah, you could say that. It's rarely a solo act. We're often looking at a polymicrobial infection here, meaning it needs a whole gang of bacteria to really get going.
To invade the tissues and cause real havoc.
Exactly. And that, of course, adds another layer of complexity to the whole diagnostic process.
Makes it even harder to pinpoint.
Right.
Speaking of which, let's get to the symptoms. The CDC, they don't hold back when they describe this.
No, they don't.
Painful abscesses, tissue getting destroyed, and then there's the sulfur granules.
The sulfur granules.
Can't forget those. It's almost like a calling card for this infection, isn't it?
It is. They're these tiny granular clumps you find in the pus, but there's a little twist.
What's that?
Well, the name sulfur granules is a bit misleading. Microbiology actually points this out.
I was going to say something didn't quite add up.
Yeah. They might look like sulfur, but they're not actually made of it.
So why are they called sulfur granules then?
Honestly, I think it's just because they resemble sulfur visually.
All right, then. So how does someone end up with this not-so-fun infection anyway? Compromised mucosal barriers? That seems to be the starting point, according to Microbiology.
Right. It all comes down to those barriers breaking down and giving these bacteria, which normally wouldn't be a problem.
Right. They're usually just hanging out doing their thing.
Exactly. But when those barriers are compromised, it gives them a chance to turn rogue.
And wreak havoc.
Yeah, pretty much.
So what are we talking about when we say compromised mucosal barriers? Give me some examples.
Things like dental procedures or periodontal disease, even trauma, like a broken jaw.
Yeah, okay, I see. Things that can disrupt those delicate barriers.
Right, and as medical microbiologists, you see these situations all the time. It's kind of your bread and butter, isn't it?
It is. And speaking of familiar territory, Microbiology, they highlight how Actinomyces israeli is often found in places like the female reproductive tract and the gut.
Yeah, that's right.
It's almost like it's part of the regular crew in those areas.
Right. Which can actually make things tricky because you might find it in, say, a routine gut microbiome sample.
And think, nothing to see here.
Exactly. But if you're not considering the possibility of actinomycosis...
You could easily miss it, couldn't you?
Very easily.
So it's another reminder to always keep an eye out for the unexpected. It also ties into that whole microbiome discussion, doesn't it?
Oh, yeah, absolutely. It's a perfect example of how things can go wrong when those delicate microbial communities get disrupted.
Like how?
Well, take something like an appendix removal, something seemingly routine, but that procedure can actually increase someone's risk of developing abdominal actinomycosis.
Really? I never would have thought of that.
It's true. It all comes down to the balance,
The balance of the microbiome.
Yeah. Disrupt that balance and you open the door to all sorts of complications.
All right, so we've got this complex microbial situation, this tendency to be misdiagnosed, and now this link to the microbiome. Let's talk about treatment. What does the CDC have to say on that front?
Well, the good news is that Actinomyces bacteria are generally pretty sensitive to penicillin.
So penicillin, that's our go-to.
It often is. It's usually the first line of defense. But of course, you've got to consider penicillin allergies.
Right, of course. What are our options in those cases?
Well, we've got alternatives like doxycycline, and sulfonamides can sometimes be used as well.
Good to have options.
Yeah.
But I'm guessing even with the right antibiotic, this isn't something that clears up overnight.
You're right about that. It's definitely not a quick fix. Actinomycosis is, well, it's stubborn.
So how long are we talking about here?
We're talking months of therapy, months of consistent treatment to really knock this infection out for good.
Months. Wow.
It is what it is. It takes time to fully eradicate this kind of persistent infection. And that's something, that's really important to explain to patients.
Set those expectations early. And while antibiotics have, done a great job of bringing down those overall numbers, the CDC did mention some interesting trends, like a possible uptick in oral actinomycosis.
Yeah, that's a bit concerning.
They're attributing it, at least in part, to the whole misdiagnosis issue.
Right, the difficulty in identifying it early on.
Which then delays treatment, I suppose, and gives it more time to take hold.
That's the worry, yeah.
And then there's the link between IUD use and genitourinary actinomycosis.
Oh, yeah. That's a significant one, especially for those working in women's health, something to definitely be aware of.
It really just emphasizes how important it is to really take a deep dive when evaluating these cases.
I agree. You need that thorough clinical workup. And maybe, just maybe, we need to start thinking about bringing in some heavier hitters in terms of diagnostics.
Heavier hitters? Like what?
Like molecular methods, for example. Imagine being able to get a quicker, more precise diagnosis. Think about how that could change the game.
It would definitely improve treatment outcomes, that's for sure. And maybe even lead to earlier detection.
Exactly. And it makes you wonder, doesn't it? Could we potentially prevent actinomycosis altogether?
Prevent it? How so?
Well, think about it. We know oral hygiene plays a role, and we're starting to understand the importance of a balanced microbiome.
So you're saying better oral hygiene, maybe some targeted probiotic approaches to support the microbiome?
Yeah, those are good starting points. It's definitely an area ripe for exploration. I mean, just imagine the possibilities if we could prevent this ancient disease from taking hold in the first place.
That would be quite the breakthrough.
It would. It would indeed.